Hi, Dr. Chris Baker. Again, thinking about transformational practice. And recently I did a video on transformational practice being completely dependent on relationship. So I thought to myself, I need to say what it is that I think makes relationship work, makes relationship, make it good for you, and make it good for the people in your practice. Of course, this goes for staff as well, but we're going to focus on parents and patients today. So here's what I was thinking. Okay, so I'm thinking, how do we communicate our relationship, our kindness, our compassion, our desire to be transformational, to help to them? First of all, remember, I'm talking about adults here. Children, you can love them to death, you can play with them, you can sweet talk with them, that's fine. We're not talking about that. We're talking about relationship with the patient's parent or with an adult patient. So here's how it works. Let's say in pediatrics, where you're treating a child patient, how do we relate to the parent, right? The parent should be right there with you. The mother or dad should be right beside you, right beside the chair, at least in the room on a bench, somewhere nearby. Why? How can they possibly understand what you're doing if they're sitting out in the reception room worrying about their child? And God forbid they hear the child crying. You can well imagine what that does to a parent. Their heart is in their stomach, or their stomach is in their throat, or something like that. Okay, so now you have the parent with you, and let's say that you are going to do local anesthetic on your patient. Mommy is sitting right there. Let's say that the child is really seeming nervous and crying a little bit, kind of worrying. Well, number one, put mommy on giving some hand support. Get a head support staffer to sit right under your left arm, if you're right-handed, at 12 o'clock, so that the child's head is kept safe. And we can talk about cuddle coat papooses another time, but even that, everything is a safety measure. And we say those words. The parent needs to understand this is for the child's safety. We're going to keep you safe, sweetie. We're going to have you sit here with someone holding you. Who do I have? Magda. We're going to have Magda giving you some head support because we're going to keep you safe. But guess what? The parent is the one listening. I'm saying this for them. I'm not saying it for the child as much. Why? Because they're not listening. They're either crying or they're paying no attention. Maybe, if we're lucky, they're busy with their little Game Boy glasses and their phone that they're playing on, their game or their movie that we have going for them on the video screen. And when I say Game Boy glasses, by the way, on a blog on our website, it tells all about them. They're fantastic because the child can work right there at their tummy without raising their arms up, without being in your way, and you can work. So if we're lucky, they're busy. If we're going to have them, they're nervous and crying and worried, they're going to be nervous and crying and worried. Nothing you're going to say is going to really comfort that. Why? Because they're nervous, crying, and worried. Mommy's even more nervous and worried. Even more. So I'm saying to the child, we're going to have Magda here giving you some head support to keep you safe. We're going to have this little tooth pillow. That's the molt prop, by the way, that Magda's going to hold, by the way. We're going to have this little tooth pillow to keep you safe and let your teeth rest. You don't have to stretch open. You think the child hears that? Mostly not. Mommy hears it though. Oh, that's what that funny looking thing is. So it's keeping them, giving them something to rest on instead of stretching open. Wow, I might like that when I have my dental work done. I've had said to me before by parents. So we're saying everything for mom or dad. The next thing that we're going to do, let's say we're going to do local. And after I do my local, I'm going to test it. I'm going to take my Explorer and I'm going to touch with mommy or daddy looking right on into the mouth. And I'm going to touch right in the gingival sulcus lightly. Obviously, if the Explorer is a prick, the child feels it and they say, ah, or some reaction occurs, then I know I've got to do a little more local. And you say, well, the parent's there, now what? I say, whoops, okay, we're going to need a little bit more medicine there. Let's go on to other areas. And we check all the way around the tooth. And I touch. Is that okay? And the child may not even answer. Or they may be busy with what they're doing, or they may keep crying. But there's obviously no reaction to what I'm asking or to what I'm doing. Then I'm going to take that Explorer and I'm going to actually place it further down into the sulcus, penetrating that soft tissue, if you will, between the tooth and the gingiva, and say, is the push okay? Again, no reaction, I'm good. Next spot. Is the touch okay? Good. Is the push okay? Good. Next spot. And we just go all the way around the tooth. Now, mommy or dad have seen this, and now they feel comforted. They see that the child didn't react, okay? Now, if the child reacts a few minutes later, ow, 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 that hurts, something or another. Number one, of course, if you think that it might need a little more local, you're going to say, wow, we're going to stop right here and do something about that and put a little bit more numbing, sleepy medicine numbing, whatever you want to call it. But oftentimes I will say, because I feel very sure based on what I have checked, that it shouldn't be causing them a reaction. So I will say, maybe we'll give a little more. Finally, I might say, we've done everything that the medicine can do. The medicine is working perfectly. And if you feel some pressure or some push or something like that, unfortunately, the medicine can't keep that from happening. So hang in there. You're doing great, and on we go. The parent is much more comfortable with the fact that the child is not. Okay. If they're not, because they're really nervous, then you're going to actually have to play this little game a little bit further out. Okay. Now I'm going to put a raincoat on, a rubber dam. I use rubber dams for restorative. I don't want to work without them. I don't want a stainless steel crown in the airway. I don't want the risk, So for me, rubber dams are ace. So I'm going to get my rubber dam all set up, and I am going to put the ring right on the rubber dam, the frame on the rubber dam, and I'm going to do in one fell swoop, I'm going to put it on the tooth. At the point I do that, in the past, I remember parents saying, mothers especially will say, can he breathe? And I say, before they could even ask the question, I place it on the tooth, get a good snug fit, immediately say to my assistant, okay, let's get the breathing hole done. And we pick the rubber dam up, hold it up, they cut right under that, make a nice little round coin-sized hole, and I say, okay, now we have a breathing hole, we have a raincoat to keep all the water out of your mouth, we're ready to work. Then, what's going to happen next? Now the parent is thinking the same thing. And she sees me pick up the handpiece. And if this is the first visit for this parent, they're thinking that dreaded word, drill. I say, okay, now Mr. Whistle Toothbrush is going to clean your tooth. He whistles and he sprays water, washes as he works. So here we go. And we use Mr. Whistle. Then the next thing I'm going to say is, now we're going to rinse it off and dry it great. Then we're going to pick up Mr. Bumpy Toothbrush and we're going to take care of all the things that Mr. Bumpy needs to do. Once the tooth is clean, we proceed. So the parent is the one listening, not the child. The child has heard very little of that, quite frankly. Very, very little. Now, the next thing that I'm thinking is I'm watching the mother, because she's right there beside me, or the dad, but typically moms, just because usually they're the ones with them. And I'm constantly thinking about how I can comfort her or support her or give information by talking, again, remember, to the child for mom's ears. That's the whole key here. So now you have an idea of some of the ways I talk to the child, and it's really geared for mom. Okay? All right. Another way that I create relationship that I absolutely love is, let's say we have an orthodontic patient. Let's say we have an 11-year-old in the chair. They are absolutely fine. They're on their Game Boy glasses. They're playing on the phone or watching their movie. They have almost no interest in what we're doing. Now, maybe they've been there 5 times before. That's fine. The point is, mom's sitting there, remember, in the room, if at all possible. Not just, do you want to come in? No, please come in. So now I delegate to one of my staff what they're going to do. Would you please fit the rings on the 6-year molars, the bands, and then I will check them, and then you can take the impression for the RPE, the expander, whatever. Meanwhile, now I get up from the chair, let the assistant sit down, and guess what I do now? I walk over to the little bench where mommy's sitting, and I say to her, would you like some coffee or some tea? Sometimes they say, oh, no, I'm fine. But often they'll say, sure. I say, hang on 1 minute, I'll be right back. And as long as nobody's calling me, needing me for another patient, I go right out to our espresso machine beside the front desk, and either I make her a cup of latte, whatever she's asked for, or I have the receptionist do it. I carry it back, or someone else brings it in after. I go back, sit down beside mommy on the bench, and start to visit. What do we talk about? Well, anything. We talk about what's happening in the community. We talk about what their summer plans are. We talk about if they're going on vacation this year. We talk about what's been going on. Have you been doing any special activities lately with your child? I mean, you know, what about, remember last month I remember hearing that he had a birthday. How did that all go? And we do keep notes, by the way, on some of these things in the chart so that we kind of know what's happening. So whatever we're doing, we're finding common ground to express relationship, to express that caring, to express that compassion, to transform their lives, the child's life, and your life. These are some of the ways that we deal with it. Now you might say, well, that's great. You know, you're a woman and you girls talk all the time. And that's true. Big advantage for us. That is true. However, I do this with the dads. Let me give you an example that happened just the other day. So the child is picking the colors for her braces, the modules, and she says the blue, and she holds up which one she wants. And I say, Kentucky blue. And the dad said, wait a minute, I'm from Florida. Could we have some orange in there too, please? We don't want Kentucky blue. Okay, so now we have something going about what's going on with Florida and the fact that he went there or why it's his team. And it's the whole relationship with Daddy and Dr. Chris is there. This is what we're talking about. Find common ground and chat with them. Let them see that you're visiting with them and someone's taking care of their child. They love it. Sometimes I have a parent that's so nervous as I'm working with the child, especially with restorative, that I look over at them and say, almost mouthing the words, this is harder for you than it is for him. And they go, you're right about that. I've had them say, do you have any Valium for me? Do you have a glass of wine? I sure could use one. You know, this is called commonality. This is called understanding. This is called compassion, right? You have it, but express it. And let me tell you, these parents absolutely love it. They absolutely accept and love that we care for the child when really we're showing them the compassion and love. So some ideas for you on relationship and how we develop it. Hope it helps give you some new ideas, some thoughts, and see where you're doing things that do express it, and see where you might add some other things. Good day, Dr. Chris, signing off.